Welcome new team members. In this presentation, you'll learn about the healthcare benefits that you have available to you as a ThedaCare employee. The insurance benefits you elect will be effective the first of the month following your date of hire. First, let's talk about the ThedaCare health plan. Your health insurance will be effective the first of the month following hire or transfer to a benefits-eligible position. The full-time employee rates apply to you if you have an FTE of 0.75 or above. The part-time employee rates apply if your FTE is between 0.5 and 0.74. If you are not sure about your FTE, please check the letter you received when you were hired or when you were transferred. Before we get into the specifics about the health plan, let's review a few key terms. The deductible is part of eligible expenses you pay first. Coinsurance is the percentage the plan pays after you've met your deductible. A copay is a fixed amount you pay for a service. The out-of-pocket maximum is the most you pay out of your pocket. Once you meet the out-of-pocket maximum, then the plan pays 100% of your eligible expenses. Next, let's talk about more detail about the health plan. The chart on this slide will show you what your deductibles, coinsurance, out-of-pocket maximum, routine exam, office visit, and hospital stay costs will be depending on whether you use providers that are in or out of network. Please note you will see an increase in cost if you see a provider in Tier 2 or out of network. Seeing a provider in the Tier 1 network helps to support our mission, vision, and strategy, including our population health initiative by supporting our business providers versus our competitors' providers. All ThedaCare providers are in Tier 1, and by seeing a ThedaCare provider, our competent team of professionals can help manage the care of you and your family. Also, seeing providers in Tier 1 will save you money. You can find a list of Tier 1 providers on the Health Plan Partners website at www.healthpartners.com/ThedaCare. Now let's talk about the health plan premium. This slide shows per pay period premium rate for full-time and part-time team members and single or family coverage. Remember, to qualify for the full-time premium rate, your FTE needs to be 0.75 or above. Your premium is deducted from your paycheck on a before-tax basis twice per month. Prevention is key to a healthier you. We would like to make you aware of the preventative services available to you at no cost. These services can help you lower healthcare costs for you and your family. You may be most familiar with annual physicals as being a covered preventative service, but there are so many more that you can take advantage of. Examples for men and or women would be mammograms, pap smears, eye and hearing exams, and colonoscopy. For children, covered services include pediatric preventative services, immunizations, developmental assessments, and lab services from birth to 72 months. For women, pre- and postnatal care, cervical cancer screening, breast pumps, and more. Preventative services are covered 100%, and the services are covered on a 1 per calendar year basis. All of these services are at no cost to you as long as you use an in-network provider. Next, let's talk about the dental plans. Only you can decide which plan is right for you. With Delta Dental, you can see any provider. If you want, you can save more if you see a provider who is a member of the Delta Dental Provider Network. There is a list of participating providers on the Delta Dental website. You can save money when you choose the Care Plus HMO, as long as you get all of your care at Dental Associates Clinic. When you choose the Care Plus option, you get a higher level of coverage and you pay less premium out of your paycheck. Your premium is deducted from your paycheck on a before-tax basis twice per month. For current premiums, please check your benefits guide. What about vision coverage? Let's talk about that now. Let's learn more about our 2 vision plan options. The full service plan covers material plus an annual routine vision examination. The materials only option plan only covers frames and lenses. Your vision plan premiums will be less if you choose the materials only option. Many health plans cover routine vision exams. The ThedaCare health plan covers an annual routine eye exam as long as you use an in-network provider. Let's talk about some additional health plan benefits that ThedaCare offers. A healthcare FSA allows you to set aside money on a pre-tax basis to help pay for your unreimbursed healthcare, dental, and vision expenses. The maximum you can contribute to this account for 2020 on a pre-tax basis is $2,750. If you have a healthcare FSA, you will get a benefits card. The benefits card works like a debit card, making it easy to pay for eligible medical expenses directly from your account. Refer to the brochure you receive with your benefits card for more details about this feature. A dependent care FSA allows you to pay for eligible dependent care costs with pre-tax dollars. You may contribute up to $5,000 per year, or $2,500 if you and your spouse file separate tax returns. This is on a pre-tax basis to pay for care at a licensed daycare facility or an educational institution for preschool children. For more information on both these plans, please look on the ThedaCare Heartbeat website under Health Benefits on the Human Resources page. The Voya accident insurance policy can help offset some of the costs associated with an injury or accident and can allow portable ongoing coverage. You are paid a flat benefit amount based on the policy's benefit schedule. Claims must be filed within 30 days of the accident or as soon as practical. For questions about the accident coverage, call Voya at 888-238-4840, option number 2. Group life, accidental death, and dismemberment insurance. ThedaCare's group term life insurance is available to all benefit-eligible team members, and this coverage is fully paid by ThedaCare. Please complete the beneficiary form that's in your benefit binder. The basic life insurance benefit is 1 times your annual base salary. In addition to the group life insurance coverage, ThedaCare also provides a $100,000 travel and accident life insurance policy. You are covered when you are traveling for business for ThedaCare, including commercial air, rail, and private vehicle travel. This policy excludes travel to and from work. Optional life insurance. If you need any more life insurance coverage, ThedaCare offers you an optional group term life insurance plan. Term life insurance builds no cash value, which is why it's less expensive than other types of life insurance. So you can afford more protection for your family. If you elect optional life insurance for yourself, then coverage is also available to your spouse and your children. You can elect between $10,000 and $340,000 for yourself. Your spouse can elect an amount that does not exceed the amount you applied for. If elected during the first 30 days of your benefit eligibility, the policy has guarantee issue, which is the maximum amount that you can be approved for without going through medical underwriting. It also means you cannot be turned down by the insurance company. The guarantee issue amount for team members is $100,000 for spouse. Is either $50,000 or $10,000, dependent on his or her age, cannot be turned down by the insurance company. When you elect optional life insurance, you can choose between $2,500 and $10,000 coverage for your dependent children, and the premium for children is the same regardless of the number of children you cover. Leave of absence. One of the benefits that ThedaCare provides to the ability to take a leave of absence is from the workplace in certain circumstances. These include medical leave for personal illness, leave to care for a family member, leave for birth or adoption of a child, and other types of leave such as military leave. After 1 year of employment, some medical and family leaves may qualify for job protection under the Federal and/or Wisconsin Family and Medical Leave Act. Information about FMLA is posted at our work locations, plus the leave of absence policy includes a section about FMLA. Except in the case of emergencies, you should apply for the leave of absence 30 days before the start of the leave. Short-term disability. ThedaCare short-term disability coverage helps you maintain your income if you experience a non-work-related injury and cannot work for a short time, fewer than 6 months. Team members are eligible for the short-term disability coverage following 90 days of benefit-eligible employment. Team members do not pay for this coverage. It is provided by ThedaCare. The plan replaces 60% of your weekly base salary after you've satisfied the 7 calendar day waiting period. ThedaCare's short-term disability coverage has a 7 calendar day waiting period with benefits beginning on the 8th day. You have the option to use paid time off, PTO, during your 7 calendar day waiting period for an approved short-term disability claim. If you do not have PTO available or choose not to use PTO, then the waiting period is unpaid. ThedaCare Voluntary Long-Term Disability. ThedaCare offers a voluntary long-term disability benefit through Sun Life, which can replace a portion of your income while you're disabled beyond 180 days. For the time period before 180 days, you are covered by ThedaCare's short-term disability benefit. Please carefully review your personalized quote enrollment form, which includes your premium rate. Premiums are based on age, salary, and the level of coverage you select. You can choose among 4 levels of coverage: 25%, 40%, 50%, or 60% of your monthly earnings to a maximum of $5,000. Once you are in the plan, you get an opportunity to increase your benefit level once every year. If you elect the benefit during your 30-day initial enrollment period, you won't have to go through medical underwriting. Your premiums are paid through payroll deduction with after-tax dollars so that your benefit, should you ever need it, would be tax-free. Plus, your ThedaCare voluntary long-term disability benefit will not be reduced by the amount of other income replacement benefits you may receive for the same disability. Voluntary long-term care. ThedaCare offers you a voluntary long-term care insurance benefit through Unum. After reviewing the brochure in your benefit binder, if you are interested in more information, please contact Human Resources to request the Unum Long-Term Care Enrollment Kit. This plan is available not only to you and your spouse, but also extended family members, such as your parents. For team members, there is guarantee issue available during the 30-day initial enrollment period. This means you will not need to go through medical underwriting unless you want to elect coverage amount that exceeds the plan's set guarantee issue level. Next, let's talk about work-life balance and benefits available. Work-life balance benefits are benefits that help team members establish balance between work and your life outside of work. But team member does not at some point struggle with balancing the needs of work with family and personal needs. Work-life balance benefits can help team members meet some of the needs. Paid time off. One of the best ways to achieve good balance between work life and personal life is to take advantage of ThedaCare's PTO benefits and schedule some much-deserved vacation time. ThedaCare's paid time off benefit, or PTO, is much more than just a vacation benefit. Team members use PTO to take scheduled time off. This time off includes a vacation, but also covers you for legal holidays if you're not working on that holiday. You can also use PTO for personal time off. Examples include taking care of personal business, attending a child's school event, or just a day for rest and relaxation. PTO may also be used to cover unexpected absences. This includes covering the 7-day waiting period for short-term disability benefit, or in the event you must miss work to care for a sick child or other family member. The Employee Assistance Program. The Employee Assistance Program provides confidential assistance for you and your family members. Adoption. If you plan to adopt a child, ThedaCare can help with some of these expenses. You can receive up to $5,000 adoption assistance. The legal plan. Finding an affordably priced lawyer to represent you when you need it can be a challenge. ThedaCare's volunteer legal plan offers a simple, affordable solution. The MetLaw plan is a legal service plan that provides legal representation for you, your spouse, and dependents for one low monthly premium. You pay your premiums through payroll deduction. Funeral leave. Funeral leave offers a measure of support to team members when your loved one passes away. Tuition reimbursement. Going back to school, you can receive up to a maximum of $2,500 per year for a full-time team member and up to $1,500 per year for part-time members for courses related to your job or healthcare-related degree. Child Learning Center. The Child Learning Center provides daycare for ThedaCare team members. Call 920-832-0800 for a tour and enrollment information. More information about all these great benefits are available on ThedaCare Heartbeat under the HR link. Do you have student loan debt? Are you going back to school? If you are searching for a way to lower your monthly student loan payments or make additional degrees more affordable, the Public Service Loan Forgiveness, PSLF, program may be an option for you. Fiducious is a company that helps nonprofit and government team members access the extremely complicated and not well-publicized government PSLF program. Do you have questions or are you frustrated with student loan debt? The new loan relief benefit from Fiducious can help you address your situation. Fiducious can help reduce your loan payments, refinance your loan, or help to restructure your loan to consolidate or enable loan rehabilitation. So who are eligible for the loan forgiveness benefit? All team members and family members who have student loans are eligible for this benefit. So how do you get started? We make it easy for you to get started, starting with taking the steps towards loan relief. Just visit the Fiducious website. If you have specific questions, you can contact Fiducious directly at 513-645-5400, then option 1. What about the ThedaCare retirement plan? We'll talk about the ThedaCare retirement and 403B savings plan next. We are going to talk about one very effective way you can brighten your retirement outlook by joining ThedaCare's retirement plan. First, let me tell you about how your employer is stepping up to help you save for the future. Your employer offers the ThedaCare retirement and 403B savings plan, and they spend time, effort, and resources to do so. The plan is specifically designed to make it easier for you to save for your own future. How? Whatever you decide to save will automatically be deducted from your pay and deposited into your retirement plan account. It's like direct deposit. Put into the account the future you will be able to withdraw from. Your plan also makes it easier to invest by offering you access to an array of professionally managed investment options, all in one tax-advantaged basis. More information about that in a moment. Now your plan also makes it easier for you to plan by giving you access to retirement experts and some cool tools from Transamerica Investment Advisors. That's the company that administers your plan. For over 50 years, Transamerica has specialized exclusively in helping millions of employees plan for a brighter retirement. And all you have to do is call their toll-free number or take advantage of their many online resources. The bottom line is your retirement plan truly is one of the best valuable benefits your employer offers you. So you definitely don't want to miss out on it. Better still, your employer will kick in some extra savings for you. In fact, ThedaCare will match 75 cents for every dollar you contribute to the plan, up to 4% of your compensation. This match is made each pay period, and you own it as soon as it hits your account. So there's not only paying the current you, they're paying the future you. So let's add it up. You can have a 3% match from ThedaCare plus 4% of your pay, and that adds up to an amount equivalent to 7% of your annual income being saved for retirement. To encourage people to save for retirement, the federal government offers special tax advantages to those who participate in their employer's retirement plans. Your plan gives you some flexibility as to when you take advantage of these tax benefits. If you choose the traditional option that your plan offers, you'll get the upfront tax advantage that I talked about now, meaning that you won't pay any taxes on your contributions as you make them. Rather, you pay taxes on the withdrawals as you take them, which is typically at retirement when people may be in a lower tax bracket. But your plan also offers a Roth option, which moves those tax advantages later. If you choose this option, your upfront contribution will be made after taxes are calculated. In other words, you pay taxes on them as they are withdrawn from your paycheck and deposited into your account. But as long as you hold onto them for at least 5 years and until at least ages 59.5, these contributions and earnings will be tax-free when you withdraw for your retirement. Which option is right for you depends on part of whether you think your taxes will be higher now or later. Of course, no one knows for sure, but a calculator on Transamerica's website can help you choose between traditional and Roth savings, or you may want to check with a tax professional. The ThedaCare plan has an automatic enrollment feature. If you do not enroll yourself, you'll be automatically enrolled at 4% deferral rate with the investments occurring in Portfolio Express. The details for the automatic enrollment are located in the front, your Magnifying Your Potential booklet. Once you've received a paycheck, you can access your account online at my.trsretire.com to set your deferral rate and choose how you want your savings invested. You can also call Transamerica at 888-676-5512 to enroll. The website and the 888 number are listed on the inside front cover of your Magnify Your Potential booklet. If you wish to opt out of the plan, call Transamerica. The ThedaCare match is equivalent to 3% of your annual compensation. If you opt out and choose not to contribute any savings, it's like turning your back on 3% pay raise each year. Remember, defer 4% to get the full match. Investing can seem like a complicated proposition. For example, you may have heard about the importance of diversification, asset allocation, and rebalancing. Fortunately, your plan offers a way to build and maintain an appropriate asset mix by making a single investment decision. The streamlined approach is designed to be a total portfolio solution meant for 100% of your contributions. It's called Portfolio Express. The automated service uses the funds available on your plan to provide Transamerica investment mix based on the year you expect to retire and the level of risk you're comfortable most with. The service automatically rebalances your account each quarter, and it gradually adjusts your allocations to a more conservative mix over time as you get closer to retirement. You can also easily track and manage your account by visiting my.trsretire.com on your computer, laptop, or smartphone. You can find out how your investments are performing, update your profile, view transaction history, and much more. But if that's not enough and you need help, your Transamerica retirement plan also makes it easy to get in touch with a professional assistant. Now let's take a look on how to enroll in your benefits. Please remember that as a new team member or if you're newly eligible for benefits, you must enroll in your benefits within 30 days of becoming benefits eligible. If you do not enroll during the time frame, you will not be able to enroll until the next annual open enrollment period or if you have a qualifying life event. Enrolling in your benefits is easy and done through Workday. All newly benefit eligible team members will receive the benefit change new hire election item in their Workday inbox when they are hired into the Workday system. All you need to do is log into Workday and launch the enrollment task for a new hire. Instructions on how to enroll in your benefits can be found on the ThedaCare Heartbeat site under Human Resources. Lastly, don't forget to review your ThedaCare 457 plan booklet. The 457B plan is another vehicle to defer taxable income, but there are certain requirements to be eligible to contribute to this plan. The plan highlights booklet will provide the information that you need to see if you are a qualified participant in the plan. If you need assistance in enrolling in your benefits or have any questions about your benefits, please call 920-830-5800 and option 2, then option 1, or you can email hrservice.center@thedacare.org. If you have a qualifying event such as birth, marriage, divorce, status change, or loss of coverage under a spouse's plan, you can call Human Resources within 30 days to make changes to your benefits. If you prefer the health, dental, or vision insurance offered through your spouse's employer, you can waive coverage now. Then if you lose your coverage in the future, you have 30 days to pick up coverage here at ThedaCare. If you do not contact Human Resources within the 30-day period, you'll need to wait until annual enrollment to elect coverage. If you need assistance enrolling in your benefits or have any questions about your benefits, please call 920-830-5800 5800 option 2, then option 1, or email hrservice.center@ThedaCare.org.